to our virtual town hall panel. This again is sponsored by the City of Steamboat Springs and Routt County in partnership with the Steamboat Pilot in Today. And I'm Lisa Slitchman, the editor, and I will be moderating. Today's panel, we're going to be looking at Governor Polis's Safer at Home order, which was issued Monday, and looking at how that is going to affect things here in Routt County. So today, our panel consists of Steamboat Springs City Council President Jason Lacy, and then our three Routt County Commissioners, Beth Melton, Doug Monger, and Tim Corrigan, who also serve as our Routt County Board of Health. So we're going to just dive into questions and let you guys answer those for our audience. So first up, Beth, we'll direct this to you. What public health orders from the governor and from the county are in effect that residents need to be following?
Thanks, Lisa, and thanks for hosting us today. The first, which went into effect yesterday, April 27th, is Colorado's Safer at Home order. So this, the governor is describing as a small and gradual reopening following this stay-at-home order, which was in effect for the month of April. And I know we'll be talking about the details of that order, but in general, we need to still be staying home as much as we can. And some businesses are allowed to resume services in a limited way under that order. In addition, we have two Routt County orders that are in effect. One is prohibiting short-term lodging through the month of May. And the second is requiring site mitigation plans for all businesses that are open, and that's in effect through May 27th. And then we did have an order in effect that limited the size of gatherings to 5, but we allowed that order to expire on April 24th because the state Safer at Home order includes a limit on gatherings to 10 or fewer people. And so at this time, Routt County is aligned with that requirement.
Okay, thank you, Beth. Doug, this question is for you. Which public health orders take precedence? The county orders or the state orders, and how is that working?
So how's it working? I'm not sure, but the precedence, yeah, hey, the precedence is always the one that's the most restrictive. And so whether it's the county one that is more restrictive than the state one, or if we don't have a rule when the county one and the county orders, then the state's rule is the primary primary rule. The governor has a big task when he's talking about 64 counties and making rules that'll affect different lifestyles and different lives out there with, you know, our recreation community, a tourism community versus a southeastern Colorado community or a southwestern or a, you know, or an oil field county or something with energy production. So the governor has a big task trying to make rules that'll fit all 64 counties. And so really the whole public health system has been set up back in 1900 when we started having these rules that most pandemics or something like that are not pandemics are local in nature. And so the statutes allow quite broad authority to the local Board of Health, which has been given to the county commissioners, becomes statutorily the Board of Health. So the most restrictive is the one that is the one that you need to be abiding by, but at the same point in time, we need to be cognizant of what's happening. And the bottom line is we want everybody to be safe and healthy, and we want everybody to be abiding by the things that keeps us safe and healthy. So I'll leave it at that. Thank you.
Thank you. Does anyone else have anything to add to that? Okay, if not, then Tim, let's look at some specific businesses. We're getting a lot of questions about specific businesses. So under the Safer at Home order, When will retail stores open and what will that look like?
Operations were allowed to reopen with curbside pickup and delivery only, with a lot of really strict requirements, including elevated and increased frequency of cleaning, no returns for items that cannot be easily sanitized, daily temperature checks for employees, good hygiene signage, outside staging areas, 6-foot distancing, gloves and masks for employees, the encouragement of virtual payments, and frequent hand washing, among other restrictions. On this coming Friday, May 1st, those same retail operations will be able to open up with inside service, again with a lot of restrictions, including the 6-foot social distancing, all of the other items that I suggested or mentioned above, and including some dedicated hours for high-risk individuals, which I guess I'm in that group now. And so, yeah, I think it's an incremental step forward. I think we, the county commissioners and the Board of Health, are supporting the governor in this incremental opening, and we think that this could work. One point of reference I'd like to direct your viewers and readers to would be a really well-developed website that the CDPHE has put together to really answer many of these questions in detail. So it would be www.covid19.colorado.gov/safer-at-home. And again, I think that's an excellent resource for anybody that really wants these detailed questions answered.
Thank you, Tim. Next up, Jason, I'll direct this question. We also have a lot of questions about restaurants and when they could open up for actual dine-in service. And if they did, again, what would that look like?
Sure. So under the governor's current safer at home order, restaurants and bars are still closed to on-site customers and service, but they're all open for takeout and carry-out service. As far as when they might reopen for on-premises service, that is still a little bit unclear. The governor did make some comments that if things go well under the safer at home order right now, that in a few weeks, possibly mid to late May, there is a possibility that restaurants and bars could reopen for on-site service. However, I just want to be clear, he has made it very clear that's far from a certainty. But if and when, obviously there will be a when that restaurants and bars open, it will probably look a little different. It will still require the 6-foot social distancing. Obviously, there will be some exceptions so that, you know, the waiters and waitresses can bring food and drinks and things like that. But as far as spacing out tables and customers, that will be required. And I'm sure that they'll have some extra cleaning protocols and things like that required. I wish I could provide some more definitive answer on when exactly that will occur, but right now it's not allowed under the safer at home order. However, if the numbers of cases and hospitalizations and things keep trending in the right direction, the governor has indicated that those restaurants and bars could reopen by mid to late May under some pretty, tight restrictions.
Thank you, Jason. So Beth, we've talked about retail businesses and restaurants. What other types of businesses will be allowed to open and when in the coming week?
So as Tim stated, retail was allowed to open for curbside starting yesterday, but beginning May 1st, retail and personal services, which is things like salons, barber shops, dog grooming, etc., will be allowed to resume on May 1st. the governor is still encouraging businesses to maximize curbside, so retail businesses to maximize curbside and delivery as much as possible to reduce social interactions in those environments. And then on May 4th, office buildings that are were not in the critical business category are allowed to reopen with 50% or less capacity. And again, the governor has been very clear that that 50% should be a maximum, and that to the extent people can work at home, they should continue to do so. It's not, let's just reopen everything as much as we can. It's really allowing additional businesses to open. And so he's still encouraging that to the extent possible, those office buildings allow people to work from home if they can. As Jason mentioned, the state is evaluating the possibility of other types of businesses, I think restaurants specifically, reopening later in the month if data indicates that it's possible to do this while controlling the spread of the virus. And I think the important thing to note on that point is that we know that it takes about 2 weeks to see the impact on the data of tightening or loosening these restrictions. And so I'm certain that's what the governor will be looking at, is what do things look like 2 or 3 weeks from now in terms of positive tests, hospitalizations, et cetera. And then the final thing that I would say about businesses reopening on May 1st, May 4th, and possibly after that, there are strict protocols in place to reduce the spread of the virus in those environments. And those are required both by the state order as well as by our local third public health order requiring business mitigation protocols. And those are really important tools for controlling the virus as we allow businesses to reopen, try to see some economic benefits, let people get back to work, et cetera. Those protocols are going to become even more important.
Thank you, Beth. Tim, Beth mentioned it a little bit about the data, but are there certain metrics being studied and watched to determine what restrictions to lift, maybe even possibly when you have to, pull people back in if we see any sort of spike? So what metrics is public health looking at? Tim, you're muted. Tim, can you?
Okay. Can you hear me now? I'm sorry.
Yes.
So we are working closely with our local public health officials to make sure that we're staying in close alignment with the governor's orders. And so we did determine locally that we met the 5 criteria defined by the CDPHE that allows for a partial reopening as set forth in the governor's safer at home orders. And so they are, number 1, disease prevalence has been decreasing and is now low. Number 2, we've determined that our healthcare system has the capacity and can handle a surge. Number 3, we have adequate testing capability to rapidly diagnose cases. Number 4, we have public health staffing that is adequate. And number 5, that we maintain our preventative measures, which really relies upon social distancing. And I'd kind of like to focus on that last one. The first 4, I think we can monitor pretty well. The part about social distancing is a concern to me. I'm worried that many of our citizens may think that with the new safer at home order that many and most restrictions have been lifted and they can go back to their normal lifestyles. And that simply is not the case. If we're going to beat this thing, we really need to continue to maintain a high degree of social distancing. And that, for me, is a statistic that I'm going to watch as closely as I can. It's pretty hard to get super accurate data about that, but there are a number of sources that we can monitor to make some kind of a judgment about how well we're doing.
Thank you. Doug, we still have a lot of questions about when people need to be wearing masks. So could you clarify that for our audience?
So basically, you know, and anytime you're in interaction with somebody that's not in your clan, I so go to say, that you need to have a face mask on. So if that's, you know, our ruling, our public health order number 3 really was going into the critical businesses and allowing those critical businesses to move on, but they needed to have face masks. And again, the face masks are to protection of the person that you're talking to. It's not to protect the individual. It's to protect the individual that you're talking with or communicating with or doing business with. And I just recommendation, just read this quickly. Recommendation regarding the use of cloth face coverings. This is from the CDC. This means that the virus can spread between people interacting in close proximity. For example, speaking, coughing, or sneezing, even if those people are not exhibiting symptoms. So in the light of this new evidence, and this is when the CDC changed positions on this ruling, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. Grocery stores, pharmacies, especially in areas of significant community-based transitions. So, you know, our recommendation is that you need to be wearing them at any time. You're not with somebody that you're with all the time. And so that, you know, we're just trying to recover here and trying to move past this place. And the faster we do that and the healthier we become, everybody. You know, and I struggle with a little bit of, you know, there's been a lot of animosity about the masks. I mean, you can wear the mask and have it down around your collar if you're not talking to anybody or not in close proximity to, and you know, the governor wears his on around his collar the whole time, and when he's in public setting that he needs to have the mask on, he actually pulls it up. So, you know, it's just part of our tools, you know, to stay at home when sick and not being out there and limit the outside interaction and wearing the mask when you're interacting with other people. So I think it's, you know, the faster we get through this, the faster we get done with it. Thank you.
Thank you, Doug, for that clarification. Jason, we have questions from businesses about what the site mitigation plan is that is required under the county's public health order number 3. Could you explain a little bit about that?
Sure. So there are several things that the county has introduced as part of the work mitigation protocol. The first issue is what's called self-screening. And this is where employees are required to self-screen for the COVID-19 symptoms each day before they come into work. And, you know, that includes things like checking their temperature. Do they have a fever? Are they coughing, sneezing, anything that might indicate that they're sick? And if they are, they need to not be at work and they need to go home. But as far, and the businesses, they need to keep a record of that. They don't, you know, one practice is that employees sign off on that each day. That's not necessarily required, but the employers do need to provide some kind of record keeping so that they make sure they are not, you know, that they're following those guidelines. There's also the physical requirement. You know, people have to stay 6 feet apart. And that obviously for some of the newer businesses that can be open, such as salons and haircuts shops and things like that, that's not going to be practical. So the 6 foot distancing won't work in those scenarios. But for any business where it is practical, then the 6 foot physical distancing is still required. Then face coverings. This is one difference on the county level versus the state. Under our local health order, all employees and customers must cover their nose and mouth with a face covering if they are in a business that is open. The governor recommends that, but however, our local order requires that for any business that's open. Signage has to be posted on the door informing all employees and customers that they should avoid entering if they have a cough or a fever, and that they must maintain the physical distancing as well. Businesses also need to provide hand sanitizer, soap, and water, either at or near the entrance to the facility, and any area where there's high frequency employee interaction with any members of the public. There are also requirements about payments. If at all possible, contactless payment systems should be made available, but if that's not practical, then they need to make sure that all the payment portals and pens and styluses, all those things have to be disinfected after each use. Also, in regard to travel, some businesses, they have employees that might be coming from in and out of other places. So businesses are supposed to limit travel by employees in and out of the county. So it doesn't prohibit travel for employees who live in an adjacent county, but it requires mitigation where that's possible. And then for older populations and people that are more at risk of contracting COVID, they're encouraged to not visit a business as much as they can. And then employers are also encouraged to provide additional mitigation for those employees whenever possible.
Thank you, Jason. Beth, have we reached our peak in COVID-19 cases in Routt County?
So the short answer is it really depends on what happens next. I think we would all hope that we've reached our peak and that we've moved beyond that. There's always a possibility of a second wave. And actually, I've been spending a lot of time reading about the Spanish flu and the 1918 pandemic. And that's exactly what happened in 1918 and 1919, is that there was a reopening because there was a concern that businesses were closed, et cetera. And there was a second peak, and that happened in Colorado. There were a lot fewer people in Routt County at that time. So I think Routt County probably wasn't directly impacted, but I know Denver was, and I know the state of Colorado was. So it really, really depends on what we do in this next phase, whether we have reached our peak or not. So right now we see a flattening or a decline in our local cases, and we have to keep that up. And stay at home made it easy to keep that flattening going because no one was interacting with each other. And so now that we are opening things a little bit, there's a much greater need for personal responsibility and for maintaining social distancing and all the things that are going to keep people safe. I've heard some people saying that maybe the virus didn't end up being as bad as we thought it would be. We don't have any evidence that that's true. It hasn't been as bad as we thought it would be because we've taken these really extreme measures to control it. And stay at home was a really blunt instrument for doing that. And right now we're moving to a tool that's a little more sustainable, where people can get out a little more, where more people can work, but it's also more tenuous. There's more risk that it won't work. And so again, the success requires a very high level of commitment from residents in order for us to be successful keeping this virus contained. And so I'll just mention that we're joining some other counties that are asking residents to take the 5 commitments of containment. And so the first is to maintain 6 feet of social distance. The second is to wash your hands often. The third is to cover your face in public. The fourth is to stay home when you're sick. And the fifth is to seek testing immediately if you have symptoms. And there are several other counties that are asking residents to take these commitments, and we'll be working to try to get that message out as much as possible throughout this phase.
Great, thank you. Jason, back to you. And Beth mentioned it there as one of these commitments of containment is the testing. So what is happening with testing? Do we have enough tests for people to actually get tested if they have symptoms? And are antibody tests available?
Sure. So this morning, just so everyone knows, I confirmed this information with our county public health director, Dr. Brian Harrington. So as of now, we have greatly improved our testing capacity. We are now at the point where we can test all people with symptoms, anyone who's showing signs of the virus, and we can obtain results within 24 to 48 hours. So that's a vast improvement from where we were several weeks ago when we really didn't even have the supplies to test everyone with symptoms. And sometimes those results would take 7 to 10 days. So we've really improved both the capacity and the turnaround time on testing for people with symptoms. We're still not quite at the point where we have the capacity to test all people, asymptomatic people, people who are not showing signs of the virus. So that is a limitation that we still have right now. And we hope to, cross that threshold soon where we would be able to test, more widely, even for people that aren't showing symptoms. As far as antibody testing, that is something that we really don't have large capacity on right now. And actually right now, there isn't even an FDA approved antibody test that is in circulation. And we are aware of perhaps one or two local businesses that have some capacity for some antibody testing. However, what the reports are that those tests can be somewhat unreliable. They have some results that tend to be they show some false positives. I've heard percentages of 30 to 50% showing that those may be inaccurate. So that's concerning. And also there are other interpretive problems that need to be worked out on these. Some of these antibody tests, they show positive results for antibodies that are really for other coronavirus family viruses. So that's something maybe a lot of people don't know is coronaviruses are kind of a family of viruses. It's not just one, there isn't just one coronavirus. So some of these antibody tests can pick up positive results for other coronaviruses as opposed to COVID-19. The other things that we don't really know yet are, if a person tests positive, we still don't really know if they're truly immune from reinfection. That's a bit of a misnomer that people just kind of assume if you have tested positive, that you will be immune from an infection in the future. And the data has not confirmed that yet. Also, we don't know how long someone might be immune from becoming reinfected. So these are some of the issues that people need to, have some patience on and just understand that even if you get an antibody test, it doesn't provide a high level of certainty that you will be immune in the future or actually that you've even had the virus in the first place.
Thank you, Jason.
Lisa, do you mind if I just add one comment on testing?
Sure.
I just want to make sure that we really acknowledge the hard work of our public health and some of our other county staff that have been working tirelessly to increase our testing capacity locally. It didn't just happen by magic. We have people who are doing a lot of work and engaging in some ingenuity to make sure that we are able to get the supplies we need for our community. And so I just want to make sure we take the opportunity to acknowledge the work that is being done by our staff to make this happen.
Thanks, Beth. Doug, we have obviously a very active community, and people still have questions about what types of outdoor activities can they do? Do they need to wear masks when they're doing them? And I would also add to that, I know we have people anxious to get out, maybe to even other areas. What are your guidelines for that?
So our guidelines, so we've been kind of lucky here. Mother Nature hasn't been too kind to us this first part. And so we've kind of been forced to kind of stay at home as well during the first part of this. But we want people, we have to look at the whole public health of things too, and that includes mental health and physical health and the rest. So we're encouraging people to get out and just not be congregating and stay with, the governor's rule says 10 miles from home and the rest, and then we look at the Eagle County rule, and it says basically we want the Eagle County to be open for Eagle County residents, and they did allow Commissioner Corrigan to be allowed in there too, by allowing neighboring counties to be involved in that as well. But we just want smart, just do the right thing, be smart about it. When we first started out, we didn't want anybody leaving their yard and staying within your confines and the rest. I think that might have been good for the first couple of weeks, but we needed to start getting out and the rest. So again, while you're outdoors, you need to continue practicing good social distancing and being dispersed activities, and again, doing those things with your clan, with your family or group, so that people that you've already been, commingling with, and that's really one of those things. Again, we're very concerned about the physical health and the mental health and the overall public health of our community. We're shortly heading up onto rafting and kayaking, and I don't think those things are a bad thing either, but we need to do them responsibly. We don't need to congregate at the water hole. We don't need to congregate at the trailhead, and so I just think those best practices need to be followed.
Thank you, Doug. Tim, we have a lot of questions about, what this is doing to the economy. And so has the county done an analysis on the economic and non-COVID health impact of the shutdown?
So I'd like to just focus on the economic side of the equation. So the Steamboat Springs Chamber did an economic impact survey, and they reached out and got answers from 250 businesses in Routt County. And the information that came back from that was pretty sobering. 11% of our businesses estimate they could survive just 1 to 5 weeks under the current stay-at-home policies. Another 27% they could last 6 to 10 weeks. Less than half of all of our businesses, 44%, said that they could survive longer than 11 weeks. That's pretty terrifying when you think about the prospect of half of our businesses being unable to survive. But I do think that there's some room for hope. Number one, we came from a really strong business environment before the coronavirus hit. We were running at less than 2% unemployment. And granted, these numbers have shot up dramatically here in the last 6 to 8 weeks. And there's no way to sugarcoat it. This is going to be tough for a long time for a lot of our businesses. But I do have a lot of confidence that we can come back from this. I think the incremental approach that the governor is guiding us with is a good approach. And I'm hopeful that if we can maintain the momentum we have in controlling the coronavirus, that we'll be in a better position 30 days from now to really think about opening up a lot of other businesses and having an opportunity to generate some economic activity, which is, I think, what we all want.
Thank you. Does anyone else have anything to add to that?
I'd just add on the non-COVID health impacts that we know our neighbors in Eagle County took a really close look at ER visits that related to mental health and substance abuse issues, and that has been a huge part of their analysis. The information we've received regarding that in terms of our ER is is not as concerning as what Eagle County saw. They saw a big increase in those kinds of cases. From our understanding, we have not seen that there. But I think there's no question that there are significant challenges to, one, being isolated, two, not having a job for some people. Although we are aware that right now, if you make less than about $55,000 a year, you're actually making more on unemployment than you were working. So I think that gives us some reassurance about those folks' well-being. But we do know that these mental health issues, and especially the potential for substance abuse, are high. And we definitely want to keep an eye on the whole picture of public health, which would include those kinds of issues in addition to the issues related directly to the virus.
Thank you. Anyone else on that topic?
Yeah, so I'd like to follow up a little bit too, if I could, Lisa. So, the county's really been working hard trying to figure out what our impacts are of the COVID-19 and the economic downturn of that as well. So, we're not exempt from any of that, and we're going to be seeing a fair amount of that. We think, anywhere between 10 and 20% of our revenue structure, and I know the city's already implemented measures to deal with theirs as well. But, we have to figure out how we can, with the diminished revenue stream, be able to continue to provide the essential government services that we've all grown accustomed to, or that are absolutely needed. So we're figuring out, we're having at least 2 hours a week having conversations about a remodified 2020 budget and what the 2021 will look, based on the information that we think that we are seeing out of the effects back into the government and the governmental services. But, just like everybody else, our governmental services are not going to be diminished. In fact, some of them are actually being increased. To law enforcement, and road and bridge will stay the same. Our mental health, our human services and things, we feel probably will be increasing. So, we're doing our own little thing, but anyhow, we're doing our own thing, trying to figure out how that's all going to fit together and how we're going to be able to fund that as well, and everybody being part of the economic downturn. So, thank you.
Thank you, Doug. Jason, anything on the city's side of things?
Yeah, and the economic impact, obviously the businesses and the business community, it's terrible what's going on, and we feel that pain as well. And what we're seeing at the city level, we are likely to be even more impacted than the county, because so much of our tax base is based on sales tax, and obviously we are going to see a huge impact to that, at least over the next few months, on the sectors that have been shut down. And I think for us, the problem we are seeing, and the difficulty we're seeing as far as how to forecast this for the long term, is we just don't know yet the duration of how long this event is going to last. So we are looking at our budget on a monthly basis. We have a couple of city council meetings every month, and we will be looking at the budget probably every night. And we've already made some tough decisions on scaling back some time for our workers, but we're doing absolutely the best we can to keep our services as much intact as possible, because we know so many people rely on things like our bus service and things like that to be able to go about their lives. So we're feeling the pain too. Of course, it's probably nowhere near the scale of some of these businesses that operate on razor thin margins. So it's a tough time for everyone, and I certainly have sympathy for everyone on that.
Thank you, Jason. This is a question I'll want all of you guys to answer if you feel comfortable, but the stay-at-home order has meant that individuals and families in our community are isolating. And so, I'd be interested to know about each of your experience in isolation and how you're handling it, because I think it's important for our community to remember you guys are human beings with families, and So, Jason, let's start with you on that.
Sure. Yeah, this has been, I won't sugarcoat. This has been a hard time for our family. I have young children. I have two boys that are in school, and they are really missing their normal life, which I'm sure a lot of people out there can relate to. They miss their school, they miss their friends, they miss their activities, they miss their sports. So this has been a real adjustment for us on a family level. And I'd also say, I have always had a huge amount of respect for teachers because I have a lot of teachers in my family. I'm the black sheep that went to law school. So I can tell you that, and what I'm seeing, and particularly my wife has been, carrying the burden of trying to help teach our kids at home. So now I have even more respect for teachers because I can see how hard it is. And that's with just, handling a couple boys. Teachers on a regular basis handle 20, 25 kids or more sometimes. So this is really eye-opening, and I can tell you that it's been hard in that respect for our family to kind of be out of our routine, as I'm sure it has been for everyone. But there, on the silver lining side of things, we've also had more time together, and it's been really nice to have some time to spend with them more so than we used to. I can tell you on the business side of things, when I'm not on city council, I'm spending my time trying to run a law practice as well. And for people out there in the business community, they know how hard right now is as well. And we're trying to do as much as we can to be flexible so that we can, flexible with our employees, flexible with our clients, because I think that's going to be the real trick to moving forward. Is if you're going to be able to succeed going forward in a business from a business perspective, I think you're going to have to do as much as you can to adapt and be flexible, and that's what we're trying to do here as much as we can. So it's it's also given me a little extra time and our family a little extra time to get outside and actually put in a little more focus on blocking off some of that time for exercise and getting outdoors. So that's been a positive, but I won't pretend it's been easy, and I don't think others out there have had an easy experience either. So that's what I would say right now.
Thank you, Jason. Beth, how about your experience in the self-isolation world?
Well, I think like all parents, I would echo what Jason said. We only have one child, and there are pros and cons to that. He doesn't have any built-in playmates. He's 4 years old. But there are two grown-ups and one kid, so we can kind of gang up on him, if you will, to keep things under control. It's incredibly challenging. And as Jason said, I mean, even in a family where we are fortunate that both of us are still receiving a paycheck, that we're able to work from home, we're not worried about where our kid is going to go during the day while we're working. And I recognize the amount of privilege that we have to be able to continue in that way. And at the same time, it is not easy. In the first couple of weeks of this, I had a very close friend attempt suicide, and that was really eye-opening for me about just how challenging all of this is for people. And I've kept that. Luckily, he recovered and he's safe and happy with his family now. But for those in our community who either don't have strong supports or who are struggling, I just really try to think about them every day, because I think it's important for us as elected officials to really stay connected to the experiences that people are having. And so as challenging as it is for me to see my son struggle emotionally sometimes with the difference. If you know much about 4-year-olds, you know that they really like routine and they really like predictability. And this is so not normal for Clark. And it's hard to see that every day. But I do really keep the perspective of how fortunate we are to be with our family, to have a good support system, to be able to live in a place where it's safe to get outside every day, and just trying to keep it all in perspective as we go through this whole thing.
Thank you, Beth. Doug, how has your experience been during this time?
Living the dream, living the dream. So no, yeah, I tell you, I have a unique perspective on this a little bit. Anyhow, my grandma passed away during the 1918 flu epidemic. My dad was 2 years old, and 6 kids that my grandpa raised by himself after the Spanish flu, and so they were at the homestead at base of Sleeping Giant. So I have an interesting perspective, and I don't take for granted the situation that we're here in. You know, personally, yeah, we've just been trying to do our own business at the ranch. It's been really hard, trying to get product and supplies that we need to do, and trying to get opened up in the spring, trying to fix fence, and trying to stay distanced as well. You know, and busy trying to acquire some bulls and buying bulls and trying to get calving through, and we're going to end up getting ready to sell some cows and a couple of cows. So it's just been interesting at that part. But at the same point in time, the commissioner business has been pretty tough. I guarantee you, it's a lot more than what we signed up for sometimes. You know, we basically have a meeting 7 days a week. We're probably, you know, especially when we first started, we were probably on, I have renamed my office chair here to be the vacuum cleaner, because it just sucks me back into the chair. And so I have renamed the chair, it's the vacuum chair. And so just because, and then on top of that, we just are inundated with emails. I mean, a lot of them good, a lot of them, you know, and then it's interesting, all of the associations that we're worked with as well. All of them are trying to earn their keep by our dues associations that they pay us, that we pay them. So all of them are sending us out, and you know, like 10 emails a day, you know, and then you add on to that how many associations we're all familiar with and use. So, you know, I could be dealing on 2 emails, and in the meantime, I'll have 25 emails show up on my thing. It's just like, it's just been overwhelming. And so, yeah, we've been spending some long, hard days and some long FaceTime on the computer. So I'll leave it at that. Thank you.
Thank you, Doug. Tim, how about your experience?
So I guess I am unmuted. Good. Yeah, I mean, my experience, Donna's and my experience, really has not been that difficult. I can only think back to when we had 4 kids here at home, and I'm really, really sympathetic to Jason and to anybody else that's in that situation. And I really also think about all those years that I was a construction worker, and that my sense of worth was really tied up in my ability to go to work every day and provide for my family. And the idea that I would be in a situation where I would be told that I could not go to work and that I had to stay at home and spend quality time with my 4 kids and my wife days on end, I fear that we would have yet another public health crisis to deal with. I know that Donna in particular struggles with being understanding that she cannot go and visit her 2 grandchildren. And I think for her that has been a very difficult thing for her to deal with. I found that the extra time that I don't spend driving back and forth to work, which for me is at least an hour and a half a day, has been good. It's been nice to have that extra time. And I have I've found some newfound enjoyment in fixing fence and clearing out ditches and even feeding horses and cleaning up horse poop. So it has not been all bad for us, but I am really sympathetic to those individuals that have a more difficult situation than I do.
Thank you, Tim.
Hey, Lisa, do you
Yeah.
mind if I ask you to answer that question? I think it'd be great for our readers to understand what happens behind the computer.
Yeah. Thank you, Beth. Yeah, we are, while again, I'm grateful that I have a job that is still going on and I am getting a paycheck. But, it's been interesting as I walk around the neighborhood, people are trying to find ways to fill their time. And for me and my staff, we're probably working harder than we ever have. So it's kind of interesting, and we're doing it remotely. And so it has its challenges. So yeah, it's hard. The stories that we hear and that we tell are, I think, again, sometimes maybe people think we don't have feelings, but when you're sharing people's stories, there's a great responsibility to do it well and to be, we just did a story about, for instance, we had Jack Taylor recently died of COVID-19. And I know John talking to Geneva and sharing that story. So, it's our job at these times. Like I tell people, we're a little bit on the front lines and we're fighting this virus with facts and information. And so that's what we're doing. But I have to say, there's, like everyone, there's good days and there's bad days. And you just have to be okay with that. And you have to embrace that. And you have to know, I tell people it's an old Dale Carnegie, for those that might remember Dale Carnegie. It's living in day-tight compartments. And so you get up and you go out about your day, and you want to do good. And that's what our team is doing. But yeah, it's not necessarily easy. So thank you, Beth. But it is an honor and a privilege to serve this community through the newspaper. And hopefully that's what we're doing. And that's what we're doing here today as well. So thank you. Okay, guys, we're coming down to the end. I guess let's go into something, and again, I kind of hate to end on this, but each of you, we've all mentioned about that this could be causing a struggle for many people. So again, on a more personal note, what is some advice that you all would give people who are struggling, who need help? Where do they turn? So Doug, let's start with you on that.
Well, it's kind of an unfair question for me. I go out and I had mental health time yesterday. I got to sit in my tractor and I actually drug meadows for a couple hours yesterday. So that's where I go, but that's not available to everybody. So, but I don't know, I guess now's a good time to, rekindle friendships and the rest and try to, make it through this thing. I think as a community, I think we're going to be stronger and better. And, I think people will be more cognizant of each other and the rest. So hopefully that will be a spin-off positive result in all this thing. But I guess one step at a time, one step in front of the other, and one day at a time. So we just continue on, and hopefully we can get past this crisis and then figure out what the next step in the COVID-19 is as well. So thank you.
Thank you, Doug. Jason, what advice would you have for people who may be struggling, really wanting to go back to life as normal?
Yeah, so I would say, first off, I'm right there with you. I have struggles every day, and I would love to be back to a more normal life as soon as possible. So I can certainly relate, and so can my family. But what I would really emphasize is don't hesitate to reach out to others for help, because it is not a failure for you to be struggling. It is not a sign of weakness. It's not a sign that you are somehow some less than worthy person. We are all going through those same emotions. So no matter if it's mental health, reach out to reps, reach out to Mind Springs Health, reach out to all the providers in this community that can help you with any mental health issues you might be struggling with. If it's understandably, if you're worried about your business and how it's going to survive, reach out to the Steamboat Springs Chamber to see what resources are available to help your business. Reach out to the Small Business Resource Center at CMC and Randy Rudasics and find what resources might be available there. Talk to your banker, talk to your CPA about whether some of these loan programs from the government might be helpful for your business. And, don't hesitate to reach out to your friends, your families, your neighbors. We're all struggling. None of us, this isn't easy for any of us. So don't ever feel bad about reaching out for help because, I think in some ways, while we're all struggling, it might be nice to hear from others that, they're having that same experience. And that kind of helps each of us draw on each other's strength to help get through this. So I would just really encourage people, don't sit there in isolation, even though we're supposed to be, in quotes, isolated. Don't use that as an excuse to not reach out to people, because there are a lot of resources and good people here that can help get through this and get to the other side.
Thank you, Jason. Tim, how about you? What advice would you have for people struggling, wanting to get back to normal?
Some of the same advice I would give them during good times, which is get outside, be nice to your neighbors, and show some tolerance. We've heard some stories of people being quite rude to each other because someone may or may not have been wearing a mask at the right time or the right place. Hey, we all make mistakes and we all have different ways of approaching things. And I think showing some tolerance will help everybody get through this. And I know for myself, one of the things that's really helped me is I keep a pretty strict routine. My routine doesn't look any different than it did when I was going into Steamboat to work every day. I get up at the same time, take a shower, have breakfast, read the newspapers, and then I try to get to work at 8 o'clock in the morning and work a regular work day and maintain some semblance of a normal life. So that's my advice.
Thank you, Tim. Beth, how about you?
Well, I would obviously echo everything that everyone has already said. I think it's important for all of us to remember the important ways that we need to take care of ourselves right now. I think all of us probably have found that it's easy to move into less than healthy behaviors, to drink a little more, to watch a little more TV, to be consumed with the news or social media. I think it's really important that we all remember the things we know about how we take care of ourselves, and really try to do those things. And then the other thing I would say is this is not just on the people who maybe are struggling, it's on all of us. And reaching out to someone, whether it's a phone call or inviting them to have a virtual get together, is really critical. So think of the people in your life who maybe live alone, who are in one of those vulnerable populations and are by themselves, and reach out to them. And I was fortunate to be able to participate in mental health first aid training several years ago. I don't know if anyone else did that. The Northwest Colorado Health, I think maybe it was the partnership, was offering that training in our community. And I just want to remind folks that if you're concerned about someone's mental health, and especially if you're concerned about suicide, if you've done that training or if you haven't, the single most effective thing that you can do to intervene is to ask them directly if they're considering suicide. And that's a hard thing to do, but it's really critical that we're all looking out for each other, and creating those connections and supporting one another. And so I would also just note that on Routt County's COVID-19 website, which is covid19routtcounty.com, there's a section with local resources, and there are links to our community organizations that can support people in times of mental health or substance abuse concerns.
Thank you, Beth. So we're down to the end, so I'll give you guys each an opportunity to maybe close with something that you didn't maybe get to say to our audience. And so let's start with Tim.
Yeah, I think the message that I'd like to send is let's really stick with it here for at least the next 30 days. I think we have the opportunity, if we can really stick with it, that 30 days from now, we'll be looking at a much better situation. Let's keep our gas in the pedal, keep moving forward. Thank you.
Thank you, Tim. Jason, how about you, a closing statement or message?
Sure. I think I would kind of echo a little bit of what Tim said. I mean, I think it's really important to recognize that we have done a very good job up to this point as a community. I think everyone from public health, our hospital, emergency preparedness, everyone has done a really good job, and you can see that reflected somewhat in the lower numbers that we've had to this point. But I think it's really important to not be lulled into complacency at this point. I think what people should probably expect is a slow phase in. It's not something that's going to just happen overnight and everything be back to normal. And there's a really important reason for that, or several reasons for that. Number one is, you mentioned, you asked me earlier on the testing. We still don't have the robust testing capacity to test everyone here yet. We also have still, even though we haven't had that big surge that we were worried about yet, we still have a situation with limited hospital beds, limited capacity to handle a big spike, and it wouldn't take very much for us to have a big spike here. We only have 39 hospital beds. We only have a handful of ICU beds, so our capacity here is still limited. So I would just urge everyone to be really thoughtful of that and mindful of that as we look ahead to trying to roll off these restrictions in a slow and orderly fashion. And I would also just emphasize again, everyone, be patient and kind as much as you can to everyone, because, we all are going to have different perspectives. I think we should wear masks until, the end of time. And we're going to have lots of opinions on when restrictions should be on or should be off, and how that should look. But the important thing is we all have to support each other and realize just because someone has a different opinion than you, that doesn't make them the enemy, and that doesn't make them a bad person. I think we can all learn from each other's perspectives and appreciate those perspectives and make better decisions by listening to all those people and all the different perspectives that they have. And I know that's what the county commissioners have done to this point, and I know they'll continue to do that, and we'll be here to support them as much as we can.
Thank you, Jason. Beth, any closing thoughts?
Absolutely. I think what I'd like to do is reassure people about how the commissioners are committed to decision making in these challenging times. And I think we've seen that there are some leaders in various communities who are really focusing on the political side of this. And I want to really reassure our community that Tim and Doug and I are wholeheartedly committed to not politicizing this, but to really focusing on the data and the best practices that come to us from our public health experts. And I think that should provide some reassurance to our community. I believe that that's the best way for us to be making decisions and not being prone to the political whims that may feel really big at some times. And so with that, I would also just like to reiterate what we've already said, which is that this is really hard for everyone. We are absolutely just as anxious as many of our constituents to get back to normal. I feel like some days I have kind of a Twilight Zone moment where I forget what an unusual time we're in, and that lasts about 10 seconds before I remember, oh wait, nothing is normal right now, and this is crazy. And so I would just also reassure people that we absolutely feel the need and the urgency to get back to normal as quickly as we can. But that requires a measured approach so that we avoid the kind of surge or resurgence of the virus, like Jason said, which would push us back into a much less normal time and back into a stay-at-home type of situation. So want to just really give everyone some empathy and remind us all that the best we can do is the best we can do, and to just be patient and kind with one another. And we will get through. The only way we're going to get through this is together. So thank you to everyone who's been making that commitment and continues to do so.
Thank you, Beth. Doug, we'll let you have kind of the final say.
Oh, thank you. Thank you so much. But and so again, I think everybody's already said that's one of the bad things about going last. But I really can't thank everybody, as like said, that everybody's been working together and really doing the best for the community and not putting self in front of the community. And I think that's really been incredible. I think that we as a local community are getting past that curve. You know, I think we are living in the effects of our success as well. We have flattened the curve, and we have changed the way things would have been here had we not done anything. If we had not sat back and done anything. At the same point in time, we're not out of the woods yet, and we're not down past the last rapid. And we need to make sure that we are vigilant here, because, as I said, I think our herd immunity, we have our local community has become, you know, pretty immune and ready if it was only our local community that we need to work with. But at the same point in time, the realistic part of his life is that our community is a tourism-based economy, a tourism-based community, and we have to figure out somehow how to open up the businesses and the tourism as well. So we have to figure out that on a measured approach and how we can do that and not give up all the things that we've done. So yeah, I don't think it's time to just, okay, we're done and walk away. We just need to be vigilant and try to make sure we're prepared for what happens when we get. That's why I think, I'm rambling now, but we geared up hard on our public health part, because I think when we get ready to start opening up the gates again, and we're not stopping people on top of Rabbiter's Pass, we're not stopping them at the airport. When we start to gear up on the influx of our population and tourism, we're going to have more effects. And so that's why it's going to be so critical for us to have a reactionary system that we can react to it as well. So, and I guess thank you for everybody's efforts, and thanks for everybody's time, and thanks, Lisa, for hosting us.
Thank you guys very much. And I do want to put this in perspective. I have a lot of newspaper colleagues around the state who have watched us do these types of panels, and they have actually reached out to their local leaders and really haven't been able to do this. So I really appreciate your willingness to answer communities' questions and for your openness and transparency. So it's very much appreciated. We will have another panel on Friday. That one will be looking at support for businesses. And I would just continue to encourage people, if you have questions about anything COVID-19 related, to please send those questions to covid@steamboatsprings.net, and also, or to news@steamboatpilot.com. Again, we appreciate everyone watching this morning, and I hope you have a good day and stay safer at home. Thank you.